Hi, everyone. I am Dr. Diane Hayden, publisher of Natural Nutmeg Magazine and Essential Naples Magazine, and welcome to our first Path to Healing conversations with Natural Nutmeg and Essential Naples expert practitioners. I'm excited today to be talking about holistic weight loss. And I have four amazing ladies on the call with me today who are going to be talking about their modalities and how they help people with holistic weight loss and the cutting edge things they're doing. So I'm going to introduce each of them, and then we're going to talk with each of them a little bit individually about what they do. And then I've got a bunch of cool questions. And as I said, any questions that you guys have, feel free to just put them in the chat, and I will make sure that we get to all of those today for our panel. So I'd like to introduce you to Dr. Pamela Cipriano. She is a board certified nurse practitioner specializing in preventative medicine. She's the owner and CEO of the IV Hydration Lounge and Med Spa, where she focuses on personalized weight loss solutions with IV vitamins, vitamin injections, and semaglutide when necessary. Her Med Spa also offers PRF and radio frequency, microneedling for skin rejuvenation, and PRF biofillers. Her practice blends advanced treatments with holistic care to support your health, wellness, and beauty on your weight loss journey. Next, we have Christine Bellotti Peterson. She is a holistic high performance coach, wellness expert, and founder of Longview Vitality. With over 30 years of coaching experience, she specializes in helping individuals achieve sustainable weight loss and transform their relationship with food and self care. Christine's approach starts with body positivity, confidence, and self love, with the philosophy getting to your ideal weight starts in the mind. Christine starts with mindset coaching, rapid transformational therapy, and personalized wellness products. As a certified professional coach, RTT practitioner, and yoga instructor, she's passionate about aligning physical health with mental and emotional well-being to help clients achieve their ideal weight. Candace Rosen is a registered nurse, social worker, nutritionist, researcher, certified health coach, and author. She is the creator of the Pancreatic Nutritional Program and the Data-Driven Diet. Her books, The Pancreatic Oath and The Pancreatic Oath Journal, were published in 2011. And her third book, Forget Dieting, It's All About Data-Driven Fueling, was released in 2020. The focus of her research is the pancreas. She is the pioneer in glucose monitoring for improved health and weight loss, and her hypothesis is that weight gain and non-communicable diseases stem from pancreatic abuse. And lastly, Jackie O'Keefe. She's the founder of Aura Light Therapy, a space born from her desire to create a healthier, more balanced lifestyle for herself and her family. After leaving an overly demanding and toxic workplace in the wine and liquor industry, Jackie flipped her focus toward promoting a healthier lifestyle and helping others feel their best through red light therapy. Her journey inspires her commitment to providing a welcoming and supportive environment for healing and growth. So welcome all of you today, and thank you so much for being on the Zoom call with us. So I'm going to start with Jackie, because I think that for me, when I heard about red light therapy many years ago, I've only known it to be used for pain relief and like other things. But we had this conversation, and she started telling me about how now they're finding that it can be used for weight loss. So Jackie, tell us a little bit just about your practice and how does that work? Unmute you. You have to unmute yourself. Oh, are you muted? 1 second. There you go.
Thank you. Sorry.
No worries.
Wonderful. Diane, you bring up a fantastic point. A lot of people have heard about red light therapy by now. It's certainly a very hot topic in so many different wellness categories. But of course, the biggest question I hear all the time is, it can work for weight loss. Is that true? Or I've never heard of that. It sounds like, snake oil. It doesn't make sense. Please tell me more. So the truth about red light therapy for weight loss is that you can't just pick up any device and expect that it's going to burst fat cells and you're going to lose 50 pounds overnight. That's not how it works. The type of device that we use in our practice is a medical grade pad light system. So when you're here, you're going to lay on a massage table, and we're going to wrap your body in flexible light pads that kind of look like a heating pad, but they're illuminated on one side. The treatment is 20 minutes, sometimes longer, depending on what we're treating. But for weight loss, 20 minutes seems to be the sweet spot. During that time, the light is actually penetrating your skin up to 2 inches below that outer skin layer, right into the body fat. The exciting, cool thing about red light therapy is that it actually works in several different ways to help people to lose weight. Primarily is the direct way. When the light reaches the fat cells in our body become overexcited and they'll tend to rupture. The fatty acids, those toxins inside each one of those fat cells, will then make their way outside of that cell wall and into the lymphatic system, where all of that is carried out through the body as waste. So that's the direct way that we can disturb body fat. What is great about the way that we're processing the fat here is we're not actually killing the fat cell, and that is really important. There are a lot of different fat loss treatments that will actually kill body fat or, like surgically remove it. When that happens, you're creating damage to the body, which, as you all know, will set off this huge stress response, flood you with cortisol. You're not feeling good, creating a lot of damage there. And when that happens, your body goes into the stress mode where it wants to repair that recent damage. And oftentimes this causes people to either retain a lot of that weight that they're trying to lose, or they're gaining more. Your body is really starving for that energy that you just suddenly removed. With the red light therapy, we're very gently helping the body to release the body fat as toxic waste. And then at the same time, we're also super fueling the rest of those bodily cells that are affected by the red light therapy. So I should probably go back a little bit and explain what the red light therapy is in general, although many of you are probably already pretty comfortable with how it works. But essentially, we're using a combination of red and near infrared light, and that is applied to the body. And when those cells receive that light energy, they become supercharged. So the mitochondria and all of those cells will essentially be supercharged, allowing all those cells to really repair themselves and other cellular, tissues around them. And this really helps people to feel great. The red light therapy helps to relieve pain, reduce inflammation, help with sleep. There's so many different incredible benefits, too many for me to list today. But that brings me into the second way in which red light therapy helps people to lose weight. When you're feeling better and you have less stress on the body, simply put, it's just that much easier for us to lose weight. I can speak for myself. I worked in a very hectic lifestyle in my previous career. I was in sales. I was stressed out all the time. I was tired of having that pregnant look after having given birth 14 years prior. And that was the stress tummy, Looks like we're all women on here. We probably can empathize with that or know a lot of people that have to deal with that. When we relieve stress in the body, it really does help for us to lose weight naturally. I do see a lot of people that come to me, they're very stressed. They have the bloat, they have that cortisol tummy. The red light therapy really does help to take away a lot of that stress, a lot of that inflammation, which is really important. But so my practice really does focus on weight loss primarily. People usually come to me and say, I'm looking to lose a couple of pant sizes or a few pounds here and there, and we'll start them on a program. This is not a one and done. The red light therapy is a gradual process. If you're aggressively looking to lose weight, we want to see you 2 to 3 times a week until you reach your goal. It might seem like a lot, but after you've tried it for the first time, people are really excited to come back. It's really comfortable, it's relaxing. A lot of people actually fall asleep during their treatment and really look forward to it, especially as busy moms. And then after that time, when they're reaching that goal, it's really great for them to come back and do like a maintenance thing. You really want to keep the shape that you've just earned. Find like a lot of diet programs and fat loss treatments will set you up, help you, lose some weight here and there, but then you're on your own and all of a sudden it comes back. What happened there? You don't really get that effect with the red light therapy. This is more of a long-term approach. One thing I always ask people after their first few sessions is, how are you feeling? I think most people are really surprised to know or to feel after those first several sessions that their pain is dissipated, they're sleeping better. Suddenly, miraculously, their mood has improved. Just so many really wonderful benefits. So there's a lot to it. I'm really happy to have gotten into the practice that I'm in now. It's been really rewarding. I'm so happy to be here talking to all of you, answer some questions and get some more information out about how red light therapy works. Because if you Google red light therapy for weight loss, you're going to find a whole lot of opinions out there on the internet. Please do not believe all of them. There's great information out there, but this topic can be very confusing for a lot of people. So I'm happy to answer any questions about it.
Awesome.
Thanks, Diane.
Yeah, thank you, Jackie. I'm glad you said that about Google because Google can be our best friend and our worst enemy.
Mhm.
And I'm glad you mentioned stress because I think that's something that we don't even think about in terms of how it affects, weight gain, weight loss, inability to lose weight, that kind of thing. And also what is happening to our bodies when we're under stress. So that's going to lead me nicely into talking to Dr. Pam. And because what she does, I think, is replenish a lot of the things through IV hydration and her spa there in terms of critical nutrients and minerals that we need to help the body basically be able to release weight. So, and real quickly, I've got questions coming in already. So I just want to tell you guys, I see them. I'm aware of them. I'm just going to get through each panelist first, and then we're going to go back and answer your questions. So, Dr. Pam, tell us a little bit about what you do and how that can help.
So we have a multifaceted approach when it comes to weight loss. What we do is we have a weight loss program. It includes a couple of different things. One includes the IV vitamins, vitamin shots, the infrared sauna, and hearing me in your ear every week. So when I went for my doctorate degree, my dissertation was on preventing the progression from prediabetes to diabetes mellitus. And this diet that I had given to my patients has turned into a living, breathing creature that is constantly evolving. And right now, the diet is broken down into food groups. Everything's low in glycemic index, and everything on there is going to help to decrease inflammation. So everyone who joins the program and any one of my patients on the medical side gets a copy of this. There's all tidbits of information of how to lose weight, how to stay healthy, and how not to regain the weight. The vast majority of people who've come to the med spa for weight loss keep it off. We have the two separate programs. One is all the vitamins and the infrared sauna. The other one includes everything I just mentioned, plus it includes semaglutide. The vast majority of people join the one that also includes the semaglutide. Both work, but I have to say the one that includes the semaglutide works much quicker. I've only had a few, I mean, literally a handful of people who've had to return because they gained either all their weight back or they've gained some of their weight back, but the vast majority didn't. And I think a lot of it is because, every week they were coming in, and it's usually anywhere between 3 and 6 months it took for them to lose their weight. They had a weekly weigh-in, all the questions I was asking them, how they were doing, how their week went, any problems. The semaglutide, the biggest complication I see is constipation. So when a person doesn't lose the weight that they're looking for, my first question is, are you having a bowel movement every day? So regardless of what your bodily habits are, we're animals. And just like animals, when we eat, we should be having a bowel movement. So at least one every single day. And if it's not a significant one, then you're most likely constipated. The colon and the small bowel can hold on to an enormous amount of waste that we don't even realize. But people can actually lose 10 pounds just from having several bowel movements in a row. That's how much you can actually hold on to. I know that the research shows that people can lose up to 15% of their body weight. We've been seeing up to 30% of their body weight. They do absolutely magnificent, absolutely fantastic. So in addition to the semaglutide, we also have something called a skinny shot, which I'm sure a lot of people have heard of. It's a lipotropic injection that has a bunch of different vitamins included. One of them is choline, which helps to distribute the cholesterol evenly. The other one is inositol, which helps the liver to release and remove fat. And then the last one is methionine, which helps to speed up and break down the fat and eliminate toxins. So what it does is it uses your fat cells as energy, so you see results a lot quicker. So especially, that little pooch that women will get, especially after having children, that's one of the first things to go. So you'll actually start seeing your abdominal muscles a lot quicker by using the Skinny Shot. The Be Lean IV does very similar things, just like the Skinny Shot does. And then the infrared sauna, depending on how much weight you need to lose, you can use up to 600 calories in 1 hour in the infrared sauna because it has the red light therapy. It has the far rays that penetrate the body to detox each cell to get rid of any toxins. And then the way the heat works, it actually increases your metabolism just like working out does. And the research shows that people who loved working out at one time and kind of fell off the wagon, once they start doing the infrared sauna, it actually gets them back into exercising because your body is actually going through the same thing as exercising. It's, the metabolism is increasing, you're sweating, you're feeling lighter, and by the time you get out of there, you feel fantastic. Like it's a great feeling when you get out of there. So that's what we offer for weight loss.
That's awesome. Wow. That's
Thank
really
you.
cool. I mean, I'm a huge exerciser, as most people know, and I didn't even think about that connection between being in the sauna and then
Yeah.
it motivating you to exercise. That's really awesome.
Yeah, that came out in a few different research articles, so that was extremely interesting to read because I'm a huge workout person. I've been doing that since I was a teenager, so my big thing is all about moving. And that's,
Right.
even what my research study was, everything was getting people off the couch and moving and changing their diet, and they literally reversed their diabetes, people who are outside the research study itself. It's just amazing how easily the body can reclaim itself. It just takes
Mm,
some effort.
yeah. Yeah, for sure. Well, thank you so much.
Thank you.
I'm going to move next to Christine. So tell us a little bit about your practice. And I love what you do because it's all about the mind.
Yes,
And
thank you, Diane.
yeah, you have a modality called rapid transformational therapy. So how do you work with that?
Yeah, so hi everybody. My name is Christine. I spent the first 25 years of my career in the corporate world doing performance coaching with executives. And over the past 8 years, I've had my own coaching practice. And I have broadened that to be a more holistic practice. So I believe in mental, physical health as a foundation, and then focusing on personal and professional goals. And I started to learn about rapid transformation therapy when I was turning, I think it was 48. And I basically said, I'm not doing this anymore. I had suffered from a 35-year emotional eating disorder, which either had me really restricting my calories or binging. It was a very much a roller coaster ride, and it had a lot to do with what was going on up here. So I believe that weight loss starts in the mind, getting to your ideal weight, and it has a lot to do with why are you struggling in the first place? And there's a lot of underlying trauma actually that goes on with weight issues. So rapid transformation therapy is a hypnotherapy that also uses your neuro-linguistic processes and cognitive behavioral therapy. So my Wellness Reset, which is a coaching program, has it's a 12-week minimum session. So you've got 3 RTT sessions, an elite self-care protocol, diet, rest, exercise, stress relief, and supplementation, a natural GLP-1 supplement, which is a cellular activator for your own GLP-1 to increase, and yoga for weight loss. And I combine that with accountability and your personalized high performance plan, and we get to it. And it has been incredibly successful. The truth is, the Wellness Reset is a more economical way of doing all of those things in 3 months in a very organized fashion. But I also basically have a menu where you can only do the natural GLP-1 if you want. You can only do the self-care protocol. You can only do RTT if you want. And I send people, to places like, where Jackie and Pam work, because I absolutely believe in a personalized protocol for self-care, which includes all kinds of holistic features like infrared sauna and IV therapy. And I do believe everybody has their own personalized protocol that works for them. I give you a couple of different assessments, so we're really helping you understand what is a stress relief for you. But RTT therapy really is all about getting you to body positivity, to believing in yourself, to reprogramming you out of self-sabotaging behaviors that usually got you into the mess of those extra pounds or not waking up and keeping your commitments to yourself. The RTT for weight loss is all about getting you to that higher self, believing in yourself, motivating yourself, and reprogramming and healing from this, the root cause of why this is going on in your head anyway. And yoga for weight loss is an added bonus, I think, because it really helps you with another way of, I call it a twofer because it's exercise, it's stress relief, and yoga is, physical relief and metaphysical relief. So there is a lot to do with people holding on to emotional weight. There's a lot that goes into that. So I'm happy to talk about that more, but that's a little bit of a summary of how my wellness reset program works.
Awesome. Thank you, Christine. I love
Thank you.
that. Yeah, and I mean, they all complement each other. I think it's just, to me, mindset is such a huge thing with anything, whether it's a health issue or weight loss or anything that we do in our lives. But all these other modalities are important as well because they can help actually affect our mindset in some ways and vice
And I
versa.
think there's so many catalysts to use that assist, whether it be, the natural GLP-1 or sort of like what's going on the inside, what's going on the outside in terms of physical exercise, what you're putting in your body, and of course the mindset you have. There are people that can eat hardly any calories and still not lose weight. Why is that? Right? They're holding on to this weight for some reason, or there's something else going on. It might be medical, right? HRT, I'm a huge fan of hormone replacement therapy for women between 30 and 60, and there's a lot to do with that, that abdominal weight that comes on but there's ways to address that for sure.
Awesome. Thank you so much. And Candace. So Jackie, Christine, and Dr. Pamela are all in Connecticut. Candace is my Florida contingency. So
it's been cold.
I know, right? Maybe you feel like you're in Connecticut.
Yeah.
So tell us how, you have a unique perspective because you've kind of honed in on one organ here. So tell us how you figured that out and how basically you believe weight gain or loss is all related to what's going on with your pancreas.
Well, thank you for hosting this and to be on a panel with all of these very tuned in women, strong women who want to help people on their journey for weight loss and improved health. On any given day, 1 in 3 women are dieting, 1 in 4 men are dieting, which tells you that diets don't really work. So I believe in a lifestyle. So my focus is on the pancreas. I believe in the practice of self-health. You're your primary caregiver. Your physician is your secondary caregiver. And my research since 2008, 2007 is focused on the pancreas. I believe it's the gatekeeper of weight loss, weight gain, poor health versus good health. And so how do I define pancreatic abuse? Anytime you raise your blood sugar over 100, 90 minutes after you eat a meal or a snack, you're asking for weight gain, you're asking for poor health, and inflammation. So the goal is to keep your blood glucose between 70 and 100. So that way you're not forcing, so when you raise your blood sugar by either eating the wrong food, the wrong amount of food, or the wrong combination of food, and you call your pancreas into action, and it's pumping in insulin, right? Because insulin acts as a key that unlocks the cell, that allows food, what you've eaten, to go in there to fuel it, whatever. You know, I talk to my clients all the time about insulin resistance. That means you're eating the wrong stuff. The insulin key is rendered ineffective, and the cell is, I can't take anymore. And then what happens to that glucose? It's stored, and then you got this extra insulin, which is referred to as hyperinsulinemia, which is highly inflammatory. So I had a study funded by Abbott Labs and Circle 1500 with 20 breast cancer patients that had a BMI of 30 plus and could not exercise at all. And testing their blood glucose like a diabetic does from 2 to 3 months, they figured out what fuel works for their body, what fuel doesn't. And it's really been fascinating because, you know, I work with a lot of patients with all sorts of different issues. My cardiac patients, it's fascinating. Their cardiologists will tell them to have oatmeal, that's a great breakfast to be heart healthy. The majority of my cardiac patients, that jacks their blood glucose through the roof. It's the worst thing that you can eat. I work with a lot of cancer patients. Their oncologists have failed to tell them that they should be watching their blood glucose. Why? Because the research was done in 1931 by Dr. Otto Warburg that cancer cells love glucose. So does it make any sense that if, you know, you were diagnosed with breast cancer and you either had a mastectomy or a lumpectomy and you're getting chemo and maybe radiation, that you have not been told that if you're eating this, this, and this, and you're raising your blood sugar, you are actually creating a petri dish for growing cancer cells, right? So Pamela would know that every oncologist in this country and around the world knows this, because what's a PET scan? You know, it helps to diagnose a malignancy or a metastatic disease. And what happens is they inject the patient with radioactive glucose, and it goes into the body and cancer cells glob onto it. So the clients that I work with and my program have, well, of course, weight loss issues. They want to lose weight. And then suffer from non-communicable diseases. So anything you can't catch. So that would be, like I said, weight gain, high blood pressure, high cholesterol, insulin resistance, metabolic syndrome, polycystic ovarian syndrome, low testosterone, renal issues, and even some cancers. So that's pretty much wrapping it up anyway.
Well, thank you. Yeah.
Thank you.
Super informative. And I think it's, you know, it's interesting because well, I've been working with a compounding pharmacist for years. And over the last year or so, I was working with him for just to try to figure out some, you know, palpitation things that I was having. And one of the things he suggested to me was actually a blood glucose monitor. Like one of the newer ones now that, like you were saying, like basically after every meal, or anything that you put in your mouth, it's telling you immediately, like, how does this affect your blood sugar? And I love what you said about oatmeal, because I bet you there's a lot of people out there who think, oh, I'm having a healthy breakfast. And it was interesting because he was telling me, I can't remember the exact foods that he mentioned, but there were things that he pointed out. I want to say it was something like, you know, like brown rice, or again, something that people think is healthy. Well, for him, it was terrible. Like it totally shot his blood sugar up. And I was like, wow, you know, that's a whole nother level in terms of trying to figure this stuff out, is why, you know, you could give somebody as a nutritionist what you think is a super healthy diet that they're going to lose weight on. And guess what? They're not. Why not? Because individually you react differently to different foods that we might think notoriously are healthy.
Right.
So,
And you know what? I just wanted to add one thing that I forgot to say was what I do with my clients is I have them look at food, what they're eating. I should say, wait a minute, look at what they're eating, what they're putting in their mouth, not as food, but as fuel for their organic machine. And each and every one of us, it's about bioindividuality. And like you said, what might work for one person is not going to work for another. And now with the new devices that you put on, so Dexcom, Libre Pro, the one thing is that I always tell clients is that you've got to be careful because there could be 10 points difference because that's actually taking, fluid, not blood. And so if you're a brittle diabetic, you should really, if you're going to wear one of these devices, you have to at least do a test with your blood with a finger stick and then scan the device so that you know exactly what you're dealing with. That spread, which could be 5 points, could be
that's
10.
interesting. Yeah.
But anyway.
So you're saying you get a different reading on the finger stick than what the device is saying. So the device is not as sensitive, let's say.
Exactly.
Okay. Yeah. Yeah. Interesting. Awesome. So I want to ask a couple questions and then I'm going to get to the questions that we put in the chat. So my favorite question is, what are your thoughts on Ozempic? And I was saying this earlier that I have had I'll say like kind of a negative opinion on Ozempic because all the side effects that you hear about and, all that, just like, the issues with gastric emptying and all that. So from what I had, the little bit of research I'd done, and my opinion on it was, I don't love this drug, but then again, I don't love any drugs. So, that's just me. But I had a negative opinion, and I was talking to an orthopedic surgeon he's one of our new advertisers down in Florida recently, and he said to me, well, I look at it differently because I'm in a situation where I have so many patients that I cannot do. They're in desperate need of, a hip replacement or a knee replacement, whatever it might be. And I can't do surgery on them because they're too heavy. And so we have to be able to get them to a safe weight to be able to do the surgery that's absolutely needed. So in that respect, Ozempic can be a good thing. So you guys, I'm going to let my panel just have at it. What are your thoughts on Ozempic? Good, bad, in the middle? What do you think?
Well, I'll start. I'm not a fan. I'm not a fan of it because unfortunately it just promotes what has been happening in this country for a long time. In the United States of America, we have the sickest population, okay? And really, they suffer from man-made illnesses, these non-communicable diseases. And people look for a quick fix. Since 1984, I would have medical students over at my house, residents and fellows, every single month when they'd finish their rotation. And I saw a difference in medical education, let's say 25, I'm 70 years old. So let's say, I don't know, maybe 25 years ago, I saw a huge decline in what I thought medical schools, how they were educating medical students. And I felt that they were graduating not healers, but pharmaceutical bartenders. And in this country, it's time for last call. And so when you look at whether it's hypnosis, IV therapy, and red light, these are healthier ways of helping somebody help themselves. So the makers of Ozempic have tons of lawsuits right now. The side effects are visual, causing blindness, gastric paralysis of the stomach is a big issue, intestinal blockages, all of this. Now, but with the orthopedic surgeon, I think that if you need to have somebody drop X number of pounds for surgery, but if they're not learning how to fuel themselves properly, then I think it's, you know. So I have a couple of people that live in my community that have been on it. They complain about their diarrhea and all this sort of stuff, but they did not want to take responsibility for their self-health. So,
Yep. Yeah.
So I have a different opinion about it because I have patients on Wegovy through their insurance company, and they're really not losing much weight at all. And then I have people who are coming through the med spa and they're following a super healthy diet, which my recommendation is this is what you eat for the rest of your life. Like, don't think of it as a diet, but as an entire dietary change. And I tell them that this is what I eat. Like, this is literally my diet. I'll be 62 years old this year. I am exceptionally active and healthy, and I keep my weight down. But if I ate every single thing I wanted to eat, there would be no way that I could do something like that. Semaglutide wouldn't be an option for me. I don't really need to lose any weight. However, if I did, I found that when doctors are prescribing it, which the majority of them don't know how to prescribe it properly. So I have had patients who ended up with gastroparesis because the amount of medication they prescribed was either too high or they were increasing it too quickly. So I'm very structured in the med spa of how quickly we increase it. And I'm looking at a certain amount of weight loss. If you're losing weight too quickly, you're not going to sustain that weight loss. You're going to end up regaining it, mostly because you're trying to lose weight so fast that you're just not eating the amount of food that you should be eating. And that's not healthy either. The most complications I've seen, and I've been doing this now for over a year and a half, and I've had hundreds of patients come through the med spa, is really constipation. That's the number one side effect that I see. The research recently came out that it does not cause medullary thyroid cancer in humans. It does cause it in animals. However, again, I wouldn't prescribe it for somebody who did have a history of it or a family history of it. But I do find that it does help patients to lose weight. And like I said, in my practice anyway, people are sustaining that weight loss, but they were also really diligent about sticking to the diet that I gave them and increasing their activity level. If you're just using it to try it, there's no magic bullet. There's no magic bullet. You have to
That's
work
what we
at
keep
it.
saying.
Yeah, you have to work at it. No
Yep.
matter what it is, you have to work at it. So that's my take on it.
How long would you keep somebody on it? Because I've heard things also about how long people stay on it.
Mhm. I think the longest person I've had on it is about 6 months. And
Oh,
in
that's
six
not long.
months,
Yeah.
no,
yeah,
that's,
she lost 60
yeah.
pounds. And
Wow.
she stayed very fit. She got back into the gym. Her knee stopped hurting her. She was able to play with her children. And she hasn't returned here either for any further weight loss. And we check in with these patients periodically just to see how they're doing. Mostly because I want to make sure they're not regaining their weight.
Right.
Yeah, that's probably my biggest concern. I mean, I don't even like to take Advil, so know that I would go natural every single time if I could, in terms of a assistant in any way. So this natural GLP-1, that is going to be one of my offers for you guys to take a look at, whether it's to try yourself or to try for your patients and clients. It is really working. It is a brand new product from LifeVantage, and it is proven. There are scientific studies that show it increases your natural GLP-1 activator by 40%. So it is working. There's lots of information out there. I'm on it myself. My daughter's on it. And I saw an immediate energy response, an immediate loss of, actually, most people are losing inches versus pounds, which is interesting, and deeper sleep. But my biggest worry, like I'm always trying to help someone's body work even more effectively. So I don't like products that shut natural body functions down, like digestion, right? Like that scares me. I don't want anyone shutting down their digestion. Um, yeah, I like everything to work. I like things to be removed, all the toxins to come out of the system as much as possible. So I'm a big natural GLP-1 fan.
Awesome.
So I'm not an expert on pharmaceuticals, but I can comment on the results that I've heard from many of my clients who have been on a lot of these drugs. And I've probably talked to several dozen of women who have been on Ozempic and Mounjaro, et cetera. And they can do it in conjunction with red light therapy, actually, which is really good because a lot of these women who are having some unfortunate symptoms will find some relief with the red light therapy, but it's, of course, a balancing act. But as far as results, I can say about half of the people that have tried these drugs have either had a negative, outlook or result, or chose to discontinue it. And I would say probably 90-ish% have all said once they discontinued the drug, the weight came right back with a vengeance. So this brings me to one thing that I always say, and I'll continue to say it until I'm proven wrong. There really is only one true permanent fat loss, and it's a lifestyle change. And find that really, if people are not ready for stepping off that, that pharmaceutical escalator and they don't have a plan when they're done, they could probably expect to be right back where they were before, maybe in a worse off situation, which is really unfortunate with a lot of these drugs. So that's kind of my stance on it. I wouldn't say I would use it myself, but like Diane said earlier, sometimes these really do have a place in our society, and obesity really is a huge health concern. And we may not talk about that enough. I think a lot of the talk around obesity is about aesthetics and looks, but it's really just so very detrimental to our health overall. And in many cases, to help people to lose weight quickly and help them to get, more healthy, generally speaking, I feel that maybe these drugs really could have a positive place for some people, but
Well,
perhaps not all.
can I just make one, just give just a short story? It sounds to me that many of your clients or whatever are coming to you because they recognize they need help.
Mhm.
They want to change their weight, their health, right? And they're coming to the spa for red light therapy or whatever. Many of my clients come because their physicians referred them. And there is this body image that is completely distorted where they, and I'll give you an example real quick. I see clients only 6 times. So the first interview, whatever, intake interview, health history, they send me their blood work and all, and it's a 2-hour session. And I have a part-time assistant that books, clients. So I get this referral, do a Zoom because the woman lives in California, referred by her physician in California. 53 years of age, 5'6", 305 pounds. So in the session beginning, I said, can you remind me who referred you to me? And she says, this physician. And I said, and tell me why you want to see me. And she said, well, he and my family think I need to lose weight. And I said, what do you think? And she said, I could stand to maybe lose 20 pounds. Because there was a pause and she goes, because it's not like I'm fat. So I said to her, well, that's very interesting. What do you mean by that? She goes, what do you mean? And I said, well, this is the first time I'm meeting you. I don't know, you made a statement like that. I just would like to know what that meant, what you meant by that. And she looked at me like I had 3 heads. And she said, it's not like I'm 400 pounds. Mm-hmm. So I said to her, that's your definition of weight? And she said, yeah. So, there's that thing that you have to deal with. And a lot of people don't understand that obesity has taken the #1 spot away from tobacco as far as cancer. Mm-hmm. And So, it's not just about the weight, it's what the weight represents. Could be present or future poor health. But anyway.
I agree with you. So when I was in nursing school 30 years ago, 50% of the population was overweight. 30 years later, 50% of the population is obese. In the United States, our diet is horrible. The amount of processed foods, the ability to actually eat healthy, the flour in this country alone is banned in other countries. I mean, we
Yeah.
don't do anything right when it comes to nutrition. And so it's no wonder that there's so many people who are obese, especially if they don't know how to eat properly. And so that's why I'm so diligent about making sure that when somebody does go on a weight loss program, whether it's with semaglutide or without, they still get the same dietary assistance to make sure that they understand what I'm giving you are really healthy foods to choose from. If you're going to eat meat, make sure it's organic. If you're going to make your flour or you're going to make bread, make sure you're buying the flour from Italy. I use Manny's Choice flour. It's literally mannyschoiceflour.com. And that's the only flour that's in my house now. We also got rid of sugar in the house. We only use monk fruit. So there's a lot of different things that I share with my patients too, that I've never been naturally thin. I've always had to work at it. But like I said, if I ate every single thing I wanted, I would not be healthy like I am, and I wouldn't be the size I am. And my size doesn't really matter. The health matters to me more than anything else. Because if I gain weight, I can't do the things that I love to do. So
And,
I completely agree with you.
and I think
And
that,
that is so true, Pam, because you have the identity and you have the mindset of
Hmm.
health, right? So
Right.
you're very driven for that. Not a lot of people have that, right? And
Right. You're
I would
absolutely
say
right.
that's why I always believe that weight loss starts in the mind, because if you think you're a fat person, right? Or if you think, oh, I'll never be able to lose weight, or if you had a traumatic incident and you relate food with love, or food is what you go to when you have anxiety or stress,
mhm.
um, then that is a pattern that of, sometimes 30 years, 40 years, 50-year pattern. So that's why, in terms of reprogramming your mindset, changing your habits, your thoughts, and your beliefs about yourself is so important. And that's why so many people that go on semaglutide or other, they just stay on it for so long, because they immediately come off and they go back to their old habits, and they don't have that chemical assistance anymore.
Mhm. The other thing I was going to say is that I think it's really important, what I say with my clients is be the light, not just for yourself, but for family members. Because children in the United States, okay, are obese for a variety of reasons, not just the food. And, I agree with Pam about what's put in all the food and all that, but the fact that they've removed recess, from school every day. We used to have recess twice a day when I was growing up. And then you had gym 4 out of the 5 days, whatever. They don't have that. And so physicians, pediatricians, okay, pediatricians are diagnosing 8, 9, and 10-year-olds with type 2 diabetes,
Yeah.
which was always called adult onset diabetes. So you got that when you were 45 and up, okay? And then you had a 2 to a 15-year window before you started experiencing these offshoot diseases, okay? Heart problems, renal issues, vascular issues, all of that. Well, if they're diagnosing 8, 9, and 10-year-olds with adult onset diabetes / type 2 diabetes, what does their 2 to 15-year window look like? Are they going to be on renal dialysis when they're 20 years old? So, when I say to my clients, it's not just about fueling your organic machine, but you have to make sure that the children that are entrusted in your care, whether it's your children, your nieces, nephews, grandchildren, or whatever, that you are preparing foods that are healthy for that child.
Yeah,
I agree.
that's true. All right, I want to get to some of the questions. So the first one is, are red light saunas effective?
So that's my question. Sorry.
Anyone who
The
wants
red
to
light sauna.
answer.
So
Yeah.
our sauna it's an infrared sauna that has red light therapy in it. And between the far rays and then the red light, it's effective for a lot of different things. So for the weight loss program, we use it obviously for the weight loss because you can burn up to 600 calories in an hour. But outside of that, I treat a lot of patients with chronic Lyme disease and chronic tick-borne diseases. And for them, they go in the infrared sauna more for detoxing. So it'll detox your entire body, goes down to the cellular level. So it's an exceptionally healthy, all natural way of allowing your body to get rid of some of the toxins that really just can't be released. It could be because of the tick-borne disease, chronic illnesses, chronic inflammation, whatever the reason is, the infrared sauna will actually help with that. And plus the red light therapy is going to help to detox as well.
Okay.
I'd
And
like to
then,
piggyback on that also,
go
Pam,
ahead.
because I think there's a lot of confusion around this subject because they're very similar, the red light therapy and the infrared. There is a similar technology, but they really offer two different things. With the red light therapy, it's a combination of red light and near infrared light. The near infrared and red are warm lights. They're not meant to be hot. In the infrared sauna, the far infrared is what you're using there, and that creates a lot of heat. So in the far infrared heated sauna, which is fantastic, I'll be installing one in my practice soon too. They're amazing. That is fantastic for the detox, like you're saying. You're going to sweat a lot. You're going to lose a lot of that junk that you don't need in your body, and you're going to walk out feeling amazing. With the red light therapy, it's a little different. We don't want you to get too hot. We want you to stay just lightly warm because that's the best way to target the fat cells, which is what we're doing with the red light therapy. So what we're going to be doing in our practice soon with the red light therapy, breaking down those fat cells, releasing the toxins, and then have them sit in the far infrared heated sauna to help detox all of that newly melted stuff, if that makes sense. So it is a different, they both work in different ways and both can have a fantastic outcome, but just slightly different. Hopefully that
And
helps to
yeah,
differentiate.
this is a follow-up to that. Are there certain individuals who cannot do red light therapy? And the same question about sauna.
So with the sauna, there's only a few exceptions. If you're pregnant, they don't recommend it, just like you shouldn't be taking hot tubs or hot baths when you're pregnant. If you have heart disease or high blood pressure, our sauna can go anywhere from 100 to 150 degrees. So depending on what your blood pressure is, I would feel comfortable, provided it's pretty well controlled, to put you in at 100 degrees and usually only for about 20 minutes. And that goes for the same thing with my patients with Lyme disease. They don't go in for an hour. They'll go in at 100 to 120 degrees and only for about 10 to 20 minutes, because that increase in heat can actually cause die-off of the bacteria, which causes more inflammation in the body, causes a Herxheimer reaction, actually helps them to feel worse. Outside of that, generally, provided you don't have some type of like a deep brain stimulator that should not be around heat, it's pretty safe for just about everyone else. I mean, even children can go in it at a certain temperature as long as it's not too high.
And the red light therapy, very similar there as well. I definitely want to emphasize how safe the red light therapy and infrared therapy can be. They do use infrared in the NICU for very fragile, newly born little babies. In my opinion, I feel like it can benefit anyone. However, it's an industry standard that we will not treat people with a pacemaker if they have cancer, women who are pregnant, or are in a very fragile state. And I extend that also to anyone with liver or kidney disease or some issue with the lymphatic system. If that applies to anyone, I have them speak with our doctor before seeing us because we do put a lot of pressure on the lymphatic system, removing a lot of waste from the body. And the reason that we're not able to treat these people, pregnant women, people with cancer, some autoimmune diseases, in my opinion, the red light therapy could be fantastic for them. There's really nothing that suggests that it would be unsafe. Unfortunately, there's just not enough information. There's not enough science out there that's published to prove that it is absolutely safe. And I don't think anyone wants to be the first one to be sued because of, whatnot. That gets into a whole other topic there.
Yeah. So we're wrapping up to the hour. I want to make sure that each of you have an opportunity to just again let people know how to contact you, and if there's anything that you want to offer to the group, just feel free to type that in the chat, or if any of you just want to make an announcement as far as how to contact you and anything you want to offer. Jackie, I'll start with you.
Sure. So right now we are offering a new client special for red light therapy. Industry standard pricing for the type of red light that we offer is between $100 and $150 per session. First session for new clients is $67. We'd like you to come try it. And also for January through February, we are doing a membership program with our sessions starting as low as $48 per session. It's really a killer steal and a great way to get started with red light therapy. We are going to be relocating our business in about a month's time. We'll be at the Exchange in Farmington, right across the street from UConn Hospital. That's where we're going to be adding our infrared sauna as well. Cannot wait for that. If you'd like to get in touch, check us out on the website, auralightTherapy.com. I did also put some info in the chat if you'd like to connect. And please reach out if you have any specific questions or would like to learn more about their subject. It's very exciting, the red light therapy. There's so much to learn, so much to talk about. And I'd be happy to answer any more questions. Thank you.
Thank you, Jackie. Candace, how about you?
Oh, you know what? I would just say that my information's out there. People can contact me if they have any questions when they start to eat to protect their pancreas. My books are available at Barnes and Noble and through Amazon. They're pretty much the Bibles on the new trend now. You see it with apps like Levels, January, glucose monitoring for weight loss and improved health, linked to the Dexcom or the Libre Pro. And all I want to say is thank you so much for organizing this. I learned so much from all of you. Very fascinating. And I booked last week my first red light session.
Awesome.
And I did it, and it was fabulous.
Awesome.
So I just want to say that. And I am a big IV therapy person, vitamin C and all of that. And I go regularly. So
That's wonderful.
anyway, and can I just say this? My daughter does hypnosis. And so she has colleagues, whatever, that I have sent my patients, clients, because they're stuck here. And now I'm going to know someone else to make a referral. So thank you very much. Anyway.
Thank you, Candace. Awesome. Christine, how about you?
Yeah, so I have two opportunities. If you want to try the GLP-1, anyone, whether you want to be a consultant and distribute it after you try it, or if you want to just try it to assist your getting to your ideal weight, I'm offering a free liquid collagen sample to anyone that does that. And then for anyone that joins the Wellness Reset, I sent the link in the Longview Vitality website. It's right in there, all of the information. You will get an extra month of accountability coaching. So the Wellness Reset is 3 months, you would get 4. And yeah, I would love to, or if anybody wants to do any kind of other session, if you want to do just an RTT session, we can give you like $100 off the first session. RTT is amazing for weight loss. It's amazing for anxiety relief. It's amazing for self-confidence. It's amazing for motivation. So anything you want your mindset to change to, whatever goals you're looking to get to the next level, we can unlock what's holding you back and really help you reprogram your mind to the opposite.
Awesome. Thank you. And Dr. Pamela.
So you can find us on ivhydrationlounge.net, also on Instagram. We always have specials running. We also have pop-up sessions or pop-up specials that'll be like just for that day or from like Thursday to Saturday. So always stay in touch with us on Instagram. That's usually where they're posted. And then we have a monthly IV that normally they're $1.99. Every month we showcase one type of an IV. January was the Lean IV. The month before that, it was the Myers cocktail, and they're $99. So that's a good way to find out if IV hydration is good for you. It's only $99, and you go with a 500cc bag or a liter bag. The same amount of vitamins are in each bag, and really, especially if you've never done it before, you'll feel absolutely amazing. Because when you're taking a vitamin, a multivitamin, you're absorbing about 8%. When you're taking individual vitamins, you're absorbing about 18%. When you're getting it intravenously or through an IM injection, you're absorbing 100%. So the amount of energy you have afterwards is astronomical. Like you feel so, so good.
Awesome. Thank you so much.
Thank you
And
so much for doing this, Diane.
it was a blast. It was a blast. Thank all of you for joining us, all of my listeners. And any questions that I didn't get to, if you want to shoot that to me in an email, I'll be happy to pass it out to our group, and they'll give you some feedback. But thank you again, Dr. Pamela and Christine and Jackie and Candace. I appreciate you guys. And our next one is going to be Wednesday, February 26th at noon, and we'll be talking about hormone imbalance, menopause, and infertility. So hope to see you all there, and hope everybody has a great rest of your day.